that time, maybe 7 o'clock, and might be worthwhile. I know everybody's time is at a premium for something like this, so we don't want to waste too much time, and we'd certainly like to get going on this. So just as a quick introduction, I'd like to introduce myself, Dr. Mark Klion. I'm a board-certified orthopedic surgeon, and I'm the co-medical director for the New York City Triathlon. Josef Geldwert, who you do not see, has been my co-medical director for the last, Joe, 3 years, 4 years? How many years?
3 years.
3 years. And we've enjoyed doing informational sessions like this. Joe is a podiatrist who's been in practice a little bit longer than me, but we go way back, and we've had lots of experience with this. So what I'd like to do tonight is present to you a little 10-minute or so discussion about overuse injuries, because that's where we are with these types of injuries, especially training for a triathlon. And then if there are any questions that you want to pose to Joe and I, we'd love to go over them. Obviously, you know, we don't have the ability to see you as a patient, you know, at this venue, but certainly we can try and give you, you know, some information on how you can, you know, train a little bit better, maybe get over an injury in the next few weeks so that you can get to July 8th, the race date, and feel confident and comfortable that you can make it through the race. So without further ado, unless, Joe, you got something else that you want to add in there?
Nope, Mark, that's great. I think you know, most of the injuries that you're going to experience are going to be overuse injuries. So Mark's intro to this will be great, and will be a springboard for all of you to ask questions.
So I think, you know, the beginning of the discussion should just be, you know, what are our goals here today? One, it's a better understanding of what an injury is, what to do when it hurts, and when to seek out some help, to seek someone like myself or Joe Geldwert or anybody else who might be convenient to you. Obviously go over some questions and answers, and then we can talk about some new and improved treatments that we have. So, you know, obviously when you talk about injuries, you know, there's always that concept of why me? Why did I get this? Well, again, just to define what an injury is, you know, you obviously have trauma. Trauma is, to us, a significant force to a normal tissue that causes failure and injury. That's obviously a fall, direct contact. You're on a bicycle, you fall, you know, you break your clavicle, break your wrist. I mean, that's kind of intuitive. These overuse injuries, though, are the enigma to medicine, in that it's a state in which there's failure of tissue to less than maximal force. Think about a coat hanger. Think about a paper clip. If you take that and you start playing with it, you're not exerting a huge force, but you're certainly imparting stress and strain to that tissue. And in doing so, these repetitive microscopic injuries that your body at some point in time can't catch up in that healing process cause it to fail. It's gradual in onset, and so for most people, when they sustain an overuse injury like this, it's gradual onset. They don't remember a discrete time that this occurred. You might ask a patient, well, when did it happen? They go, you know, maybe over the last few months it's progressively gotten worse, but they don't remember the single direct time. And that's classic for that type of overuse injury. So again, why me? Well, it's not an injury, you know, it's not an act of God, you know, it's just not bad luck. It really indicates that the athlete has reached a breakdown point. The muscles, the tendons, the ligaments, all the tissues that make up our body are made of collagen proteins. Think of it like a rope, a huge hemp rope. We have normal healing responses. You know, when we sustain injuries, we cause bleeding. Bleeding's good. Hematoma formation, that's the blood that sits around the injury site, is good. You know, in excess it might not be so good, but in response to normal healing, it's all good. That cellular recruitment that's there causes healing of the tissues. That's a great thing. It's when you start to abuse the tissues that you delay that response, that you develop scar tissue. These overuse injuries, again, it's repeated, and when you get that repeated injury, so I've hurt myself a little bit, you know, it hurts a little bit when I run, not so bad I can make it through, and you keep going on it, now the tissue cannot heal, and it causes scar tissue formation. So in essence, why me? Well, you have to be careful, but all injuries are curable if they're caught early, and that's the significant aspect to this. So what do you do once you get something like this? Well, it's steps to recovery. You know, obviously recognize that there's a problem. I think the big thing with athletes like ourselves, and obviously you have to know that both Joe and I, you know, compete. So we've been there, we've done that, we've lived through these things, and we are just as bad a patient as most people that are out there. You know, it's human nature to say, not so bad. I can deal with this. That's the problem. The first time you don't recognize it and you don't do something about it, that's when it becomes chronic in nature. So I tell everybody, and we always tell everybody, take positive actions. The first thing would be to treat the cause, not just the effect. So if there's swelling, yes, indeed, put some ice on it, but you have to think about what caused that. Don't be a martyr with this. No pain, no gain is just not an acceptable concept when we talk about injury and healing and rehabilitation. It should not hurt. Now, when we talk about treatments and when you ask some questions, we'll find situations in which we say, well, is there good pain? Is there a bad pain? How can I make it through? We'll talk about that, but you have to be very careful in recognizing pain as a signal that your body's telling you that you're doing something, incorrect. Treat thyself. Yeah, it's important. That's just as important as training, is being able to treat these injuries and make sure that you get to the starting line in a timely fashion and in a healthy fashion. And obviously with this, you want to seek out professional help. So injury recognition, like I said, we're all bad patients. We desire to push through. They have this gradual onset, so we don't remember when this really happened. And there's often no obvious signs of injury. Although I told you that with microscopic injury, there is bleeding and there is that hematoma formation. Sometimes it's deep. Especially with a hamstring, a little hamstring strain, you're never going to see the blood that is created with that injury. So you go, well, gee, I don't see anything, I don't feel anything, but it's there. It just hurts. And again, we come to that concept of good pain versus bad pain. Bad pain is something that's there with you every step of the way. That's got to be the red flag that says, I can't do this stuff anymore. Good pain might be the situation in which, I'm a little stiff, a little achy when I start, but, as I proceed and as I continue to do my activities, it seems to warm up. That sometimes is acceptable, but it needs to be improving such that the next week, the week after that, that stiffness is going away. Now, experience and maturity are certainly our best friends. It's very easy to get caught into the scenario of where your friend says, hey, let's go out, let's go for a run. I know you're hurting a little bit, but it's going to be good for you to run. You've got to take a step back and realize that you are an individual, you're very different than the next person, and you've got to take care of that injury. And honestly, now being, in the master's category, I've learned my lesson, and it's important that you continue to do that. Take positive actions. Again, if it hurts, don't do it. I hate to say that to an individual, and we don't like to say that. There are certain times that you have to, and those are the stress fracture situations in which you can't, impact load. But you need to find a way not to make it hurt. And again, there's lots of other activities. It might not be sport specific per se, but there's other things that we can do, and that's really modifying the activity. The other thing that's important is I think everybody should really have a workout logbook and an injury logbook. You can make them one and the same, but having a logbook and plotting out where your workouts are, you'll be able to find that time that was the causation of that injury. So lesson learned is you don't want to make that mistake again. And obviously, ask for advice, because really you're not alone in this. There's a bunch of great physicians that are out there, that are as active as you, that know and understand what's going on, and it's important to seek out those opinions because, one, they respect your desire to continue, and two, they've been there and they know what to do. So I think we'll talk about this a little bit, and then we'll start to answer some questions, but treating the cause and not the effect. Again, recognition, take the proper steps. The acronym of RICE, rest, ice, compression, elevation. We like to use the terminology of relative rest. So again, if it hurts, don't do it. We take that statement out, and we like to have you do things as long as it's not hurting you. Equipment issues, I think, are very important, specifically with running. The shoe on the right shows you a date. I date all my shoes. I know Joe does this. It's important because shoes do wear out. Now, again, we can have a whole conversation about, the minimalistic shoes and where that fits into all of this, but I think running shoes do have a definite lifespan. Orthotics definitely do have a lifespan, and you need to pay attention to that stuff. Training programs and bike fit also follows into that, is that, just picking up a bike at a bike store and not really getting it fit right is definitely a recipe for disaster to a certain extent. Training programs, very important. If you are seriously considering training, you should have someone help you along the way. It's okay to look at a book and to read and to get up a schedule, but you really need to have some assistance, whether it's a club, someone else to give you some guidance so that you can train properly. Obviously, dietary considerations are always important. Calories in equal, calories out equal calories in. If you deprive yourself of the appropriate calories, you deprive the cellular mechanisms from actually, healing your body. Supplements, it's always a question that is asked. I think you have to be careful with supplements, especially vitamins. Vitamins can be toxic if taken in high doses. There's lots of literature that's out there. I'm a fan of, eating well, taking a multivitamin if that's what you feel you should do, but I think you have to be very careful about taking excessive supplements. And there's not a lot of great scientific literature that says that they actually do what they're touted to do. And we can touch upon that a little bit later also. Recovery, I think, is very important, that there should be recovery days. It's both physical, mental, as well as for people that do long-distance events, there can be immune dysfunction, suppression. We know that marathoners often get ill, right after a marathon. And we certainly see that at the long-distance, half Ironman and Ironman. It's a lot on the body, to train that much. Sleep is important. Again, this is the time when the body heals itself. And I think you can really take a little tidbit home, is that if you monitor your resting heart rate, that with which you wake up with, so when you get up out of bed, and actually you don't get up out of bed, but lay there awake, take your resting heart rate. If you look at it over a period of time and you see that there's a little rise in that heart rate, let's say your resting heart rate's 60, but now your heart rate's 70 in the morning, that can be an indication that either you are overtrained or that potentially you're about to get sick. So it's a kind of an easy thing to kind of judge and gauge where you are in terms of your training. The concept of no pain, no gain, again, we talked about this. Good pain sometimes resolves with warming up. Bad pain is persistent with activity, so you want to change the mechanics of the activity. Again, treat thyself, important. Activity modification, we touched on that. Apply ice. Ice is really, really important in this. It helps reduce inflammation. If there is some swelling, elevation is always good. People often ask, what's elevation? Elevation is really the extremity above the level of the heart. That's where gravity is going to pull the drainage away from that area that's injured and bring it back centrally. Obviously, you can't, put your arm up in the air for 24 hours a day, but you can try to maximize that as much as possible. And then I think another important concept is the missed workout syndrome. This is, well, gee, I was feeling sick for the last 2 days, and I missed really 2 important workouts. I got to make this up. So you start to jam that into, the next workouts, and next thing you know, you're in that overuse picture. You've increased more than 10 or 15%, and now suddenly you have an injury. So I think you have to be careful with that. Sleep, obviously, we talked about, and eat, we often talked about, and certainly, we're not a psychiatrist, but we often feel like psychiatrists. You would like to find a like-minded soul, whether it's a physician or a physical therapist. We're all able to kind of look and make the diagnoses. There's a lot of great physical therapists who are out there. You need to follow the plan, and this injury log is important because when you're going through that injury, and day to day, it's very easy to get pigeonholed into, I've been doing the Advil trick, I've been doing my therapy, and